How does hepatitis A differ from B and C? When we talk about hepatitis, we often hear about hepatitis A, B, and C. While they all affect the liver, they are quite different in how they spread, how they progress, and how they impact our health. Let's break it down. First, let's look at how these viruses are transmitted. Hepatitis A is mainly spread through the fecal-oral route. This means you can get it by eating food or drinking water that has been contaminated with feces from an infected person. This is more common in areas with poor sanitation. On the other hand, hepatitis B spreads through contact with infected blood and bodily fluids. This can happen through sexual contact, sharing needles, or from mother to child during childbirth. Hepatitis C, like hepatitis B, is primarily spread through blood-to-blood contact. This often happens when sharing needles or through contaminated medical equipment, although sexual transmission is also possible but less common. Next, let's discuss the course of the disease. Hepatitis A typically causes an acute infection. Most people recover completely within a few weeks to months without any lasting liver damage. In contrast, hepatitis B can lead to both acute and chronic infections. While many adults clear the virus naturally, those infected as infants or children are more likely to develop a chronic infection. Chronic hepatitis B can lead to serious liver complications over time. Hepatitis C can also be acute or chronic, but more than half of those infected will develop chronic hepatitis C, which can silently damage the liver for years. Now let's talk about chronicity and liver damage. Hepatitis A does not cause chronic infections, so it does not lead to long-term liver damage. However, chronic hepatitis B can result in cirrhosis, liver failure, and even liver cancer. Studies show that about 15 to 25% of people with chronic hepatitis B may develop serious liver disease. Similarly, chronic hepatitis C is a significant cause of liver cirrhosis and liver cancer, with approximately 5 to 25% of those affected developing cirrhosis within 10 to 20 years. Vaccination and treatment options also differ. There are effective vaccines for both hepatitis A and hepatitis B, which help prevent these infections. Unfortunately, there is no vaccine for hepatitis C. Treatment for hepatitis A focuses on relieving symptoms, as the infection usually resolves on its own. Chronic hepatitis B can be managed with antiviral medications, but it is not usually curable. Hepatitis C, however, is often curable with new direct-acting antiviral drugs that can clear the virus in most patients. Finally, let's consider the clinical implications for liver health and cancer. Since hepatitis A does not lead to chronic infection, it does not increase the risk of liver cancer. In contrast, chronic hepatitis B and C are major risk factors for hepatocellular carcinoma, which is the most common type of primary liver cancer. Therefore, managing chronic hepatitis B and C through regular monitoring, antiviral treatment, and lifestyle changes is essential for reducing the risk of liver cancer and maintaining liver health. In summary, hepatitis A differs from hepatitis B and C in its transmission method, disease progression, and the availability of vaccines. Understanding these differences is crucial for effective prevention and management of liver health. Always consult a healthcare professional for personalized advice and treatment options.